Welcome to the Radiology Review podcast, your on-the-go source for radiology education with your host, Dr. Matt Covington, a board-certified radiologist. Please follow the podcast on Twitter at RadRevPodcast. Send emails to theradiologyreview@gmail.com or visit the website theradiologyreview.com.
Welcome back to the Radiology Review podcast, your free on-the-go source for radiology board reviews. On this episode, I will discuss MQSA and ACR regulations for mammography, including the mammography audit. This is a topic that I think is undercovered in many board review resources, yet is very important for the ABR core exam and high yield for the ABR certifying examination for those test takers that elect mammography to be a part of the ABR certifying exam. My hope is that this podcast episode will be helpful for many of you to successfully answer questions on ABR core exams or other radiology examinations. I will also have a free study guide available on this topic that you can download on my website, theradiologyreview.com. Before we get into the questions and answers for this episode, I want to share one recent review of my podcast that I have seen on Apple Podcasts, and this review is titled Very Helpful, High Quality. The review says, great, short, approximately 20-minute episodes highlighting high-yield topics for the ABR core exam, supplemented by study guides online at the website. Thank you for this review. I appreciate that you find the episode length to be appropriate. I do target episode lengths so that they will fit into many people's commutes or workouts or other on-the-go moments to not be too long or too short. I also appreciate the concept that the podcast is supplemented by study guides that are available on my website. That is certainly my intention, that you can listen to the audio of the podcast episodes and then go and read the questions and answers in written form. And I think this combination of audio and written education may be most beneficial for many of you learners. I have recently added share links so you can share my podcast episodes directly from my website on your various social media accounts. And if that is something you are interested in, to share these free radiology podcast episodes with your followers, I hope that providing these share links on my website for the podcast episodes is something that may be of benefit to you. Finally, I simply wish to say thank you. Thank you to each of you for listening to this podcast. Thank you to each of you who have left reviews. And thank you to each of you individuals that have written me at theradiologyreview@gmail.com to let me know your thoughts on my podcast. Without further ado, let's get into this episode. First question: what is the definition of a positive mammography screening examination? And when I say definition for this and other questions, what I am referring to is what is the definition in the ACR BI-RADS Atlas. So in this case, what is the definition from the ACR BI-RADS Atlas for a positive mammography screening examination? A positive mammography screening examination typically means that a screening exam has been given a BI-RADS Category 0 assessment. The ACR BI-RADS Atlas goes on to state that although use is discouraged, and I emphasize that the BI-RADS Atlas discourages you from doing this, if a screening exam was given a BI-RADS 3, 4, or 5 assessment, that would also count as a positive screening examination. Again, the BI-RADS Atlas recommends that we only use BI-RADS 0 for a positive screening exam, meaning that there is a finding that needs further workup. And for the ABR core examination, I would definitely avoid assigning a BI-RADS 3, BI-RADS 4, or BI-RADS 5 assessment on a screening mammogram. If you see a finding that needs further evaluation, it should be given a BI-RADS Category 0, and that is the definition of a positive mammography screening examination. Next question: what is the definition of a positive diagnostic mammography examination? The first question asked about a screening exam. Now I am asking what the definition of a positive diagnostic mammography examination is. A positive diagnostic exam is an exam that was given a BI-RADS 4 or BI-RADS 5 assessment. Next question. What is the definition of a negative diagnostic mammography examination? A negative diagnostic examination is an exam that was given a BI-RADS Category 1, Category 2, or, importantly, Category 3 assessment. Note that BI-RADS Category 3 is considered a negative assessment, so if a BI-RADS 3 exam turns out to be cancerous within 1 year of a BI-RADS 3 being assigned, this would count as a false negative examination in your mammography audit. So one example of a false negative assessment is a cancer that is diagnosed within 1 year of a screening exam that was assigned BI-RADS 1 or 2, or a diagnostic exam that was assigned a BI-RADS Category 1, 2, or 3. Next question. What are the 3 types of positive predictive value discussed in the ACR BI-RADS Atlas? I remember the first time I encountered positive predictive value 3, I was bewildered because I did not understand how there could be more than one type of positive predictive value. Nonetheless, the ACR BI-RADS Atlas describes 3 types. Can you tell me what these are? Let's start with positive predictive value 1, which is often abbreviated PPV1. Positive predictive value 1 is the percentage of all positive screening examinations that resulted in a diagnosis of cancer within 1 year of the screening exam. Note that PPV1 equals the positive predictive value of screening examinations that resulted in diagnosis of cancer within 1 year of the screening exam. Positive predictive value 2 is the percentage of all positive diagnostic examinations recommended for tissue diagnosis or surgical consultation that resulted in a cancer diagnosis within 1 year of the diagnostic exam. And positive predictive value 3 is the percentage of all biopsies. Okay, again, positive predictive value 3 is the percentage of all biopsies performed as a result of a positive diagnostic examination that resulted in a cancer diagnosis within 1 year of the biopsy. Per the ACR BI-RADS Atlas, positive predictive value 3 is the biopsy yield of malignancy or the positive biopsy rate. I also think that positive predictive value 3 is probably the most likely type of positive predictive value that would be tested on the examination. However, I would be aware that PPV1 relates to screening examinations, PPV2 relates to diagnostic examinations, and PPV3 relates to biopsies that are performed. There are some exceptions to what I just stated that are discussed in the ACR BI-RADS Atlas. And if you are interested to learn more, go ahead and access a copy of the ACR BI-RADS Atlas and read about the positive predictive values and how they are defined. Nonetheless, what I have presented keeps it simple and I think will allow you to successfully answer many questions that you could encounter on radiology board exams. Next question. What is the ACR BI-RADS Atlas definition of sensitivity? Sensitivity is defined as the probability of interpreting an examination as positive when cancer exists. I will repeat this one more time. Sensitivity is the probability of interpreting an examination as positive when cancer exists. Next question. What is the ACR BI-RADS Atlas definition of specificity? Specificity is the probability of interpreting an examination as negative when cancer does not exist. Those definitions are very important and very easily tested, so I would make sure that you have those in your memory. Next question. What is the ACR BI-RADS Atlas definition of cancer detection rate? The ACR considers cancer detection rate as the number of cancers detected per 1,000 patients examined. 1,000 is really the key thing to remember. that the rate you are describing for cancer detection rate when you are talking about mammography performance is the number of cancers detected per 1,000 patients examined. For screening mammography, the screening cancer detection rate is the number of cancers per 1,000 screening examinations. Next question. What is the ACR-BI-RADS Atlas definition of the abnormal interpretation rate? The abnormal interpretation rate is the percentage of examinations interpreted as positive. For screening mammography, the abnormal interpretation rate is the same as your screening recall rate. Next question. Are BI-RADS Category 3 assessments included for consideration when determining an abnormal interpretation rate for a diagnostic exam? The answer here is no. A positive diagnostic exam is an exam that was given a BI-RADS Category 4 or 5 assessment. A BI-RADS Category 3 assessment is considered a negative exam for a diagnostic study, and therefore BI-RADS Category 3 exams do not count towards the abnormal interpretation rate for diagnostic mammography. Next question. Name as many of the data points as you can that are specified for the basic clinically relevant audit. According to the ACR-BI-RADS Atlas, the basic clinically relevant audit, which is the audit I would be most familiar with for radiology board exam purposes, includes that facilities must obtain many data points that include the dates of the audit period, the total number of exams considered in the audit, broken down by number of screening exams and number of diagnostic exams that were interpreted, and separate audits should be performed for screening versus diagnostic imaging. These should not be grouped together. The audit should also include the number of BI-RADS 0 recommendations that were made, the number of BI-RADS 3 recommendations that were made, the number of BI-RADS 4 and 5 recommendations that were made, results of tissue diagnosis in terms of being benign versus malignant, the results for BI-RADS Category 0, 3, 4, and 5 assessments in terms of being benign or malignant, and note that you must attempt to collect tissue diagnosis results for all exams for which tissue diagnosis was recommended, whether that biopsy was performed at your facility or elsewhere. You must also obtain data regarding cancer staging metrics, such as the histologic type of cancer, invasive cancer size, nodal status, tumor grade, and you need to include analysis of any known false negative mammography examinations. That is a long list, but basically, if you acquire those data points, you have acquired the majority of what is required for the basic clinically relevant audit. That leads us to the next question. What about BI-RADS Category 6 cases? Are BI-RADS Category 6 cases included in the basic clinically relevant audit? As a reminder, BI-RADS Category 6 cases are assigned to imaging that is performed when breast cancer has already been diagnosed and has not yet been surgically resected from the breast. All BI-RADS Category 6 cases will be obtained in patients who currently have breast cancer still in their breast. It has not yet been surgically resected. BI-RADS Category 6 cases are not included in the audit. Reasons why include that these examinations are all known to have cancer, so these exams are not performed to evaluate the presence or absence of malignancy. Also, including these cases would skew the data for diagnostic exams because these all have cancer, so the cancer detection rate for BI-RADS Category 6 cases would end up being 100% and would falsely elevate your diagnostic performance metrics. The purpose of the audit is really to determine the performance of cancer detection in those cases where the presence of cancer is unknown. Once cancer is diagnosed, further pre-surgical, pre-excision BI-RADS Category 6 cases are no longer counted in the audit. Next question. After collecting the data for the basic clinically relevant audit, what calculations need to be determined? The calculations that must be determined for the basic clinically relevant audit include true positives, false positives, PPV1, PPV2, PPV3, and PPV again is abbreviation for positive predictive value, so you need to calculate all three types of positive predictive value that we have discussed: the cancer detection rate, the percentage of invasive cancers that are node negative, the percentage of minimal cancers, the percentage of cancers that are stage 0 or 1, and the abnormal interpretation rate for screening exams, which is also the screening exam recall rate. Next, what is the definition of a minimal cancer? A minimal cancer is an invasive cancer that is less than or equal to 1 centimeter in size, or ductal carcinoma in situ of any size. Minimal cancers are the smallest invasive cancers defined as being less than or equal to 1 centimeter in size, or ductal carcinoma in situ. Even if that DCIS is extensive throughout the breast, it would still be considered a minimal cancer because it is DCIS, ductal carcinoma in situ, and is not invasive. Next question. According to the ACR BI-RADS Atlas, what are the 3 major goals of breast cancer screening? According to the ACR BI-RADS Atlas, the 3 major goals of breast cancer screening are as follows. First, find a high percentage of the cancers that exist in a screening population. In other words, have a high cancer detection rate. Second, find those cancers within acceptable ranges of screening recalls and recommendations for tissue diagnosis. The goal is to maximize the cancer detection rate while minimizing cost and morbidity to the patient. To evaluate for your success here, you should look at recall rate and the positive predictive values to help inform whether these goals are being met. Third, find a high percentage of small, node-negative, early-stage cancers, as these are the cancers more likely to be curable per the ACR BI-RADS Atlas. This is why data such as the percentage of node-negative cancers, the number of minimal cancers, and the number of stage 0 and stage 1 cancers are collected. Next question. After analysis of medical audit data, acceptable mammography performance for cancer detection rate and abnormal interpretation rate are what? In other words, what is an acceptable cancer detection rate and what is an acceptable recall rate per the ACR Atlas? An acceptable cancer detection rate is that one should detect greater than or equal to 2.5 cancers per 1,000 examinations. Remember, we covered before that cancer detection rate is always the number of cancers per 1,000 cases, and according to the ACR Atlas, breast imagers should detect at least 2.5 cancers per 1,000 examinations. According to the ACR BI-RADS Atlas, the abnormal interpretation rate, which when discussing screening examinations is also your screening recall rate, should be in the range between 5% to 12% of all screening exams. That means more specifically that a BI-RADS Category 0 assessment should be assigned between 5 and 12% of the time when reading screening exams, and that is considered an acceptable recall rate. And finally, the last question for this episode: how frequently must breast imaging audits be performed? According to the ACR Atlas, an audit must be initiated no later than 12 months after the date a new facility becomes certified, and then be completed within an additional 12 months of when the audit was initiated. So if you start a new breast imaging center, you must initiate the process of collecting your data for the audit within 12 months after the center has become certified, and then complete the audit within an additional 12 months. The reason for this delay is it does take a while to, first of all, acquire enough examinations to be audited and then to complete the audit. So they give you a little bit of extra time up front. And then after that initial audit is completed, the audit is then performed every 12 months thereafter. I now want to present a few of my own personal thoughts regarding studying for the ABR core exam and ABR certifying exam in regards to the breast imaging audit. For the ABR core exam, residents should know basic concepts of the audit, many of which I have outlined in this episode. For the ABR certifying exam, for those that select breast imaging as emphasis areas, the test taker must know detailed information and must carefully study the BI-RADS Atlas and other sources to be up to date on audit requirements and other ACR and FDA requirements for breast imaging practices. Please be aware that questions on the breast imaging audit and acceptable performance metrics for screening and diagnostic mammography are fair game on the ABR core exam and are something that you should feel comfortable with prior to taking the examination. I hope that was helpful for you. Again, I do have a free downloadable study guide detailing these questions and answers that you can access on my website, theradiologyreview.com. Also, if this episode or other episodes are something that you would like to share on your own social media accounts, please go to theradiologyreview.com and you will find those share links provided on my website. That's all for now. Keep up the good work. Study hard. Remember, you have to study really hard to succeed on radiology board exams, so prepare to succeed. I will catch you on the next episode. Content of this podcast is provided for informal educational purposes only for radiology trainees and radiologists. Medical practitioners, please make your own independent assessment before suggesting a diagnosis or recommending any course of treatment. This podcast should not be used for self-diagnosis or self-treatment and is not a substitute for independent professional medical care. Please consult your own physician regarding any diagnosis, imaging interpretation, or course of treatment.